Welcome to our overview of parenteral drug targeting. In this video, we'll explore the main concepts and strategies behind targeted drug delivery systems. The primary aims of drug targeting are to enhance delivery to the site of action, prolong retention at the action site, and reduce side effects at any other site. Drug targets may include specific organs, such as the brain in Alzheimer's or Parkinson's diseases, or the lung in cystic fibrosis. Targets also include tissues like tumors and sites of inflammation, subcellular components such as cytoplasm, mitochondria, or nucleus, and invading organisms like bacteria and viruses. An effective drug targeting system must be non-toxic, specific to the target, and capable of releasing the drug from the delivery system at the site of action. Drug carriers can be soluble drug systems, where drugs are conjugated to water-soluble polymers or antibodies, or particulate carrier systems, such as liposomes and nanoparticles, where drugs are either bound on the surface or entrapped within the carrier. Drug carriers are designed to be large in size, typically over 10 nanometers, to avoid elimination by the kidneys. However, the body has other mechanisms, such as mononuclear phagocytosis, for eliminating large molecules. The mononuclear phagocyte system, also known as the reticuloendothelial system, consists of bone marrow monoblasts, blood monocytes, and tissue macrophages found in the liver, spleen, and lymph nodes. Its main function is to eliminate foreign bodies, including bacteria, and it can destroy drug delivery systems after injection. Opsonization is the process of coating bacteria or foreign particles with opsonins, which facilitates recognition by phagocytes, followed by engulfment and destruction. Opsonins may be proteins or antibodies, with antibodies having a Y-shaped structure. The Fab region binds to foreign particles, while the Fc region is recognized by phagocyte receptors. Let's see how opsonization works in action. Opsonization is influenced by particle size and surface charge. Particles smaller than 100 nanometers may escape opsonization, while those around 1 to 2 micrometers are optimal for opsonization. Neutral particles circulate longer than charged ones, and positively charged particles are rapidly cleared by opsonization and phagocytosis. Coating particles with hydrophilic polymers like polyethylene glycol, also known as PE gylation or stealth coating, can suppress opsonization and phagocyte recognition. PEG's large number of hydrated groups sterically hinder interactions with opsonins. To avoid uptake by the mononuclear phagocyte system, particles should be less than 100 nanometers, neutral in charge, and have PEG coating. To reach the target, the delivery system must exit blood vessels through the endothelial lining. There are 3 types of endothelial linings: continuous, found in brain, lungs, and muscles; fenestrated, with gaps of 20 to 80 nanometers, found in kidneys and the gastrointestinal tract; and sinusoidal, with gaps of 150 nanometers, found in the liver. Drug delivery systems can pass only through fenestrated and sinusoidal capillaries. In inflammation, gap size in liver capillaries increases to 200 nanometers, and in cancer, it can increase to 300 nanometers. Passive targeting utilizes biological and pathological conditions to allow preferential accumulation of delivery systems in the target areas. Uptake by the mononuclear phagocyte system can be used to treat diseases within macrophages. Additionally, elevation of certain enzymes during inflammation can help selectively release drugs from the carrier at the inflamed site. In cancer, increased vascular permeability allows selective passage of drug delivery systems through large endothelial gaps. Cancer tissues also have decreased lymphatic drainage, which helps retain the delivery system longer. This is known as the enhanced permeability and retention, or EPR, effect. Let's learn more about the enhanced permeability and retention effect. Active targeting depends on the interaction between a ligand attached to the delivery system and a specific receptor on the target. The ligand binds covalently to the drug for targeted delivery. One example is the folate receptor, which binds to folic acid. It is present at low levels in most cells, but is upregulated in cancer cells. When a drug binds to folic acid, endocytosis occurs, allowing intracellular targeting of anti-cancer drugs. Antibodies, produced by the immune system, bind to specific antigens on tumor or microbial cells. They can be used as drugs, conjugated directly to drugs for targeting, or attached to carriers containing the drug. Lectins and glycoproteins bind specifically to each other. Lectins are overexpressed on tumor cells, so glycoproteins can be used to target anti-cancer drugs. Glycoproteins on microbial cells can be targeted by lectins for antimicrobial drug delivery. Drug targeting can also use prodrugs, where the drug is modified to an inactive form. This prodrug remains inactive and is selectively transformed into the active drug at the target site. Dopamine is a water-soluble drug with poor transport through the blood-brain barrier. Its prodrug, L-DOPA, is inactive and can pass through the barrier easily. After crossing, L-DOPA is transformed by decarboxylase enzyme into active dopamine. However, decarboxylase is also present outside the central nervous system, so L-DOPA can be converted to dopamine peripherally. To prevent peripheral transformation, L-DOPA is co-administered with carbidopa, a decarboxylase inhibitor. Carbidopa does not cross the blood-brain barrier, so it only inhibits peripheral decarboxylase and does not affect central transformation of L-DOPA to dopamine. Stilboestrol, an anti-cancer drug for prostate cancer, can be modified into an inactive prodrug, stilboestrol diphosphate. Elevated levels of alkaline phosphatase enzyme in cancer tissue selectively convert the prodrug into its active form. In antibody-directed enzyme prodrug therapy, or ADEPT, an antibody enzyme conjugate is injected first. After a few hours, the prodrug is injected. When the prodrug contacts the enzyme at the target site, the active drug is formed from the prodrug. This concludes our overview of antibody-directed enzyme prodrug therapy as a strategy for targeted drug delivery.